Every time I've worked with a data team on a model for solubility, hepatotoxicity, or cardiotoxicity, or any other model, the first instinct in the room was the same. Oh, we must have thousands of relevant experiments somewhere in our archives. So projects start to go find them. The data spread across databases, lab systems, spreadsheet, all reports, individual scientist folder, even geography, like labs around the world. And finding it takes months. I remember one project where the team told me, so you want our data? No problem, we can ship them to you. So I asked them, what do they mean? They said, the data are actually printed. Okay. Then the team assembles it. And the protocols have changed from experiment to experiment. Units are inconsistent, assay conditions are actually missing, negative results were never recorded. Compound IDs don't quite match. And nobody's left who can tell you why half of the experiments were even run. So you end up with thousands of numbers, not necessarily thousands of comparable scientific observations. And this gap between actually what you find and what you want is the whole problem. And it's not just my experience. There is now a number attached to it. Landrum and Riniker in 2024 published something on that. So they went and checked what happens when you merge IC50 or Ki values for the same compound and target from different assay sources. Under minimal curation, almost 65% of the points disagree by more than twofold. 27% disagree by more than tenfold. Same compound, same target, different labs. Harmonizing the label, same compound name, same target name, does not harmonize the experiment. So you recognize this paper if you caught my last video, Artificial Intelligence in Drug Discovery, what it is, where we stand, and the path forward, by Andreas Bender and his colleagues. It was published recently in Nature Review Drug Discovery. I think it was earlier this month. So that's the one paper that's mentioned in it. And it had a section specifically on data generation strategy. And that section is what pushed me to make this follow-up video. So just on that part. So the paper has a name for why label matching, the label matching trick above, doesn't work. It's called conditional data. So their line is data are not knowledge. Understanding a process functionally and parameterizing it with data to support real-world decision-making is. A number without its protocol, its system, its concentration, its time point attached isn't a fact that you can reuse. It's a number that used to mean something to someone somewhere once. So what's the fix? Because just get better data is not a strategy. The paper actually draws this as a twofold loop. And it maps almost exactly onto something I keep relearning the hard way. So phase one is explorative. Small, deliberately designed data set, testing different sets of a proxy assay purely to find out whether that proxy actually predicts the clinical endpoint you care about. Phase two is production. Once you know the proxy holds up, only then do you scale the data generation up, tune the model on the larger set, and integrate it with pharmacokinetics to translate to the real clinical situation. Small first, prove the signal is real, then you scale. That loop only works if the model and the experiments talk to each other continuously. Active learning. Not run 10,000 experiments, hand the dataset to the AI team, and then hope for the best. So AstraZeneca published exactly this in 2024 with Giandini and his colleagues. And Giandini is actually a co-author on the Nature Review paper that I mentioned before. So they described a platform where the model helped pick the next experiment, not just explain the last batch. And there's a specific warning attached to that approach worth knowing. A 2020 study on active learning found that a model overall accuracy score doesn't reliably predict how good it will be at finding your next best candidate. You can have a technically strong model that's still bad at the one thing you built it for. Cell painting is the positive counterexample on the data side. The same Nature Review offer list includes Srijit Seal, who co-wrote last year's Decade in Review on it. The idea there isn't a bespoke assay per question, it's one standardized, information-rich readout built to answer questions nobody's asked yet. I want to be fair to the historical data side too, because Novartis Data42 platform got something right early that's easy to forget now. By their own account, in 2020, Data42 connects around 2 million patient years of data and over 2,000 clinical studies. They were among the first to go this big on gathering historical data, among the first to bet real money on the idea that it had a value. Worth flagging, this is clinical development data, not the discovery assay I've been describing in the rest of the video. So it's a different problem, even if it sounds similar. But from what I've seen and from people I still know working on pieces of that program, it didn't move as fast or predict as well as the size of that investment led people to expect. The instinct behind it was gather everything in one place and the insight will follow. In practice, that turned out to be a lot more complicated than that. Some of that work is only starting to pay off now. The real lesson wasn't more data in one place equals value. It was that you have to start from the problem, then go find the data, old and new, that actually answers it. And new data isn't automatically the easy half. Human-generated data bring its own mess too. Either way, it doesn't change the core issue. Rescuing yesterday's data and fixing today's data production are two different jobs, and most of the industry effort, Data42 included, has gone to the first one. I think it's also worth flagging where the money actually goes. A lot of budget lands on rescuing historical data, and anyone who's worked in this field long enough knows why that's hard. Go back just a few years and historical data becomes so massive, so inconsistent that making sense of it is close to impossible. What I've seen across a number of organizations is that budget keeps flowing into rescuing yesterday's data instead of fixing how today's data gets produced. But here is the catch. Your new data will be historical data soon enough. If you don't make it fair, contextualize, produce so it's reusable, it's a reusable asset and not a single-use one. You're just manufacturing today's problem. You're just manufacturing tomorrow's problem today. And we're only getting better at producing data at scale. So within a few years, we'll have generating more data than all of history data combined. So the advice I keep coming back to is find the right balance between fixing your forward flow of data and rescuing historical data. Don't let all the budget go to the past. And here is the actual operating principle. And it's the one line I want you to leave with. Start with the problem, the actual scientific question, the actual business question, not with the data. Then the model. Then go to the data the model needs. I've heard the same story from more than one pharmaceutical exec who's been through this. They built the biggest data lake they could and assumed the gold will turn up eventually. It doesn't actually work that way. The model shouldn't sit downstream of data production, waiting for someone to hand it a data set. It should participate in deciding what data gets produced next. But none of that works until the problem, the model, and the data are actually lined up in that order. Everything else, the protocol, the context capture, the small then scale sequencing, is just what that alignment looks like in practice.